It's entitled Skin Conditions and Mental Health, to be moved by Sir Edward Leigh.
Thank you, Mr. Gray. I want to start my speech by saying a point I'll make at the very end, that mind and skin are linked, and we have to take action on both if we are to break the vicious cycle of psychological harm. I suppose really I should declare an interest right at the beginning of this debate, not a financial interest, but a personal interest that I have rosacea that, of course, makes your face red and can ultimately deform it, and I take antibiotics every day. There are many more serious conditions. I don't make a big thing of it. But only today, in relation to something else I said on a completely different subject in the House of Commons, I've already got one email accusing me of being a red gammon head and a ruddy face buffoon. I take it with a pinch very lightly, because I know I'm already old and ugly, but I think for young people, this kind of personal abuse about their appearance is deeply upsetting and drives many people into deep psychological harm, because mental health and physical health are intrinsically linked, and knowledge of this link has driven recent advances in NHS service delivery and underpins much of the thinking in the long-term plan. Whilst this has led to the development of trailblazing and new services for many people with long-term conditions, for some reason, people living with skin conditions continue to have dire access to psychological services. Indeed, the APPG's report, the All-Party Group on Skin, which I chair, report in 2020 into the mental health issues faced by people living with skin conditions demonstrates that the psychological impact can be severe. And in terms of the effect of this on their work, education, and health care use, we should all worry about this, as 60% of us live with some form of skin condition. Inevitably, since the publication of the report, the developing impact of the COVID pandemic has made a bad situation worse. One of my colleagues, who might speak in the debate, said that he was just told only by his GP recently that he may have to wait a year for an appointment over a skin condition. With many patients with inflammatory skin disease now experiencing a 12-month wait for a first appointment with a dermatologist, the levels of stress and anxiety experienced by many individuals has risen significantly. I therefore want to spend this debate outlining the need for commissioners and health leaders to rethink how the NHS provides psychological care for people living with a skin condition. The APG's report on the mental health associated with skin conditions is available on the group's web pages. The report was based in part on a survey conducted by dermatologists and psychologists of 500 skin patients, with evidence also collected from 100 clinicians and 16 dermatology-related charities. The report was led by experts from the British Association of Dermatologists. The survey part of the report found that 98% of skin disease patients felt that their condition affected their emotional and psychological well-being. Yet astonishingly, all of the patient representative and professional organisations providing evidence stated the NHS mental health provision for skin was, quote, poor or very poor. In addition, over half of the patients surveyed didn't even realise that they could ask for help with managing the mental health impact associated with their skin disease. And this clearly demonstrates just how under-resourced services are in this part of the NHS. I'd like to draw the attention of the House to some other worrying findings that our research highlighted in the report. 93% of patients surveyed said that their skin condition had a negative impact on their self-esteem. 83% said their skin condition negatively impacted their sleep. 73% said their skin condition negatively impacted their intimate relationships. And 5% said they'd contemplated suicide. 5%. Sadly, I've been informed by healthcare professionals working in our NHS dermatology services that patients living with skin conditions are at increased risk of self-harm, as we well know, and that a number of sadly do go on to take their own lives. There's also a great economic impact with the double whammy of both skin disease and the psychological burden associated with it. Some patients surveyed said that their skin disease had been so distressing that they had felt that they had to give up their job. Let me read a very brief excerpt from a quote within the report. When I turned 19, the eczema, became so bad that I couldn't participate in normal life anymore due to the pain. I had to give up my job as I'm always too unwell. Of course, Our skin is implicated in everything we do, and it's often not understood that skin conditions don't just affect the individual living with them, but the wider family. In terms of the impact on intimate relationships, let me read you a quote from the report. "My skin is often too painful to have intimate relations with or to even hug or kiss my partner. I had to postpone my wedding as I can't cope with the idea of a flare-up on my wedding day." Recent research and evidence suggests that parenting a child with a chronic skin condition can trigger parental stress, and the all-party group survey also included responses from some children. Let me tell you, Mr. Gray, that every one of the children surveyed indicated that their skin condition had negatively affected their mental well-being, with the vast majority surveyed reporting that this had impacted on their performance at school. One of the children that provided a quote for the report said, "I was so depressed. I felt like I was rotting away inside with an alien growth on my face. I didn't want to exist like that. I wanted to chop my own head off." All this emotional turmoil for a child living with cystic acne. Clearly, if we don't support such children, the distress they experience in relation to their condition may go on to have a long-term impact on their future well-being. There are some good services out there, and the report highlighted a few trailblazing services such as the specialist IAPT service in Sheffield and the well-established psychodermatology services in some of the London hospitals. There are also psychological interventions being tested, and approaches involved cognitive behavioural therapy, merged with mindfulness and self-compassion, are there showing great promise. Nevertheless, our report demonstrates it's very much a postcode lottery, with many hospital dermatology services not having access to psychological services or clear pathways for referring people at risk on to the support that they need. Alarmingly, fewer than 5% of dermatology clinics across the UK are providing any level of specialist mental health support for children and young people. And in Wales, believe it or not, there are no dedicated psychological clinics, and there's certainly none in Lincolnshire, and a very small minority of trusts have them. This is a ludicrous situation. Research shows that psychodermatology clinics are more cost-effective to run when compared to managing skin patients with psychological distress in more generalist healthcare settings. Therefore, I urge the Minister to look at how funding is allocated and spent in this area. COVID has made things worse for dermatology patients, with poor access to face-to-face consultations, further preventing assessment and identification of mental health issues. The need for embedding psychological screening and access to psychological intervention within dermatology services is not just made in our report, but as a feature of most of the recent treatment guidelines that have emerged from reviews of the academic literature and consultation with experts. For example, the British Association of Dermatologists' recent guidelines on the treatment of the depigmenting skin condition vitiligo makes it clear that there should be access to psychological support. Further, there are some conditions that, whilst primarily psychological in nature, pretty much always present in dermatology services. For instance, skin-specific delusional conditions and medically unexplained itch disorders can be devastating, and without clear access to psychological services, such patients can be placed at considerable risk of having their underlying condition going untreated. Again, recent British Association of Dermatology guidelines in this area of practice make it clear that services need to be developed to meet the needs of this specific group of patients, but investments have not been forthcoming. As I draw to the end of this speech, let me share another disappointing fact with the House. The all-party group have looked into the mental health of skin patients and service provision on two prior occasions, in 2003 and in 2013. Our most recent report shows that despite a general recognition of the need for better care in this area, and leaving aside the more recent impact of the pandemic, most, I'm afraid, of the recommendations from these previous reports has not been acted on by government. This seems to me to be something of an indictment of those responsible for the planning commission of these essential services. So what should we do? Well, we can start by building parity of esteem between dermatology services and other long-term conditions, both in access to specialist dermatologist care, something which would of itself reduce the psychological impact, and in relation to access to psychological services. In order to achieve this, our report makes a number of recommendations. All NHS dermatology units must have regional access to psychodermatology services with clear pathways for patients to be referred to for appropriate psychological intervention or support. There must be a stepped care pathway that starts with good quality screening and enables patients to speedily access the most economic and effective psychological services that they require and deserve. This is already in place in many other long-term health conditions such as diabetes, but not so for skin conditions. And this cannot longer remain the case. It is simply not good enough. To achieve this, we need to both increase staffing in dermatology services and to improve dermatology and psychological training of all NHS staff that have regular contact with patients with skin conditions. This includes training for trainees, primary care conditions, as well as training for secondary care specialists. Research funding for psychodermatology should be prioritised. This should focus on the development, evaluation and implementation of a range of psychological and educational interventions for patients with skin conditions. The inclusion of patient support organisations in service development is critical to both amplify patient voice and to ensure that patients have clear access to some of the excellent services available in the community. So going forward, NHS mental health funding provided to local commissioners must urgently be used to invest in and improve mental health services. In conclusion, Minister, I commend our report on mental health and skin disease, which demonstrates the alarming lack of psychological support available to people living with a skin condition. It provides national policymakers, commissioners, and local service providers with an expert consensus on how mental health support for people with a skin condition should be structured in a range of clinical settings. This can be delivered cost-effectively. It also outlines the urgent clinical need for healthcare professionals to be equipped with the necessary skills and resources to provide the holistic care that patients need. This must include, and this is where I end, patient assessments and care that treats the mind and skin together. Otherwise, you will not break the vicious cycle in which problems create psychological problems that in turn exacerbate the skin condition. We ultimately hope, Mr. Gray, that through the publication of this report and this debate, the need for action will be made clear to policymakers and service commissioners working in the government and the NHS, and I look forward to hearing from the Minister.
The question is, this House consider the matter of skin conditions and mental health. Rachel Maskell.